As you well know, European Obesity Day is a dedicated annual disease awareness day and campaign that takes place around the majority of European countries. We try to bring together specialist medical community, political community, patients, but also public opinion at different events across Europe. And I will invite people coming from different countries just to say, when the discussion will start after the presentations, what is happening in each of the countries that you are represented to mark European Obesity Day. We try to motivate and support overweight European citizens to reach and maintain a healthy weight and improve their health and the quality of life. The focus on 2011 is on Stop Yo-Yo campaign. Is a tool to help citizens break the dangerous cycle of repeated loss and regain of body weight. You will find in your dossier the key campaign messages, but also in the presentations and your discussion, you'll find a lot of interesting ideas and proposals.
50% of the EU citizens are already overweight or obese. This is a reality. Unless prevention type 1 campaign, the statistics still shows increases. So why is that so? Prevention type 2 and prevention type 3, together with treatment, are not put in place. And unfortunately, the citizen stays alone facing his overweight, trying alone to combat the disease with inappropriate solutions that leads to failure and increase the yo-yo effect. Shortly, what is the yo-yo effect? You have received the yo-yo, you all know what is this kind of thing. So it goes down and then it goes up again. And this is the way of doing a regime occurs, because this is nothing that you can live with. You can make a regime for a while, you can drop kilos for a while, but when you stop it, you have the rebound of the yo-yo and you gain a little bit more. This shows maybe clearly also that the statistics are getting worse. We need really to stop the yo-yo and to go to other answers that the scientists can offer us, because there we are speaking about durable solution, sustainable, and this is something we have really to promote.
What puts off clinicians in my situation very often about obesity is that all the evidence we have on how to manage obese patients results in loss of 1 or 2 kilos over a year, 2.5 kilos if we're lucky. But the point is we can do so much more for our obese population than just measuring a couple of kilograms weight loss. We can identify them. All these studies that say our drug induces a weight loss of 5% in these patients. Not in my practice, they don't, because these are research patients in laboratories who are signed up to trials and who have to take the drugs. They have to take them for 5 years, otherwise they're off the trial. It doesn't matter how good a drug is in that situation if I don't engage with my patient because they've walked in with an ingrowing toenail and I haven't bothered to raise their awareness of the obese state that they're in. If they came in with an ingrowing toenail with a fag in the mouth, I'd be certain to deal with that problem, with that health risk. Obesity's got to be the same. We can't turn a blind eye to it. So that's the first call of action. Don't turn a blind eye to obesity. Second, just briefly on bariatric surgery, because I've got a bee in my bonnet about it, is that bariatric surgery, weight loss surgery, is one of the most cost-effective and clinically effective methods, procedures in any field of medicine. But because the wrong people are making the decisions on who gets it, the wrong people are getting it. It should be clinicians, not politicians or bureaucrats, making the decisions. So more bariatric surgery, please. The third call to action is really already being done, and that's, as Jean-Paul has said and I said earlier, all these fantastic patient groups all over Europe, let's work together and share best practice, also share worst practice, i.e. we did that, it were rubbish, don't bother with that, just to share experiences and work together. So thanks again to EOD for doing that. Politicians, prevention of obesity is really important, but without management of the currently obese population, as Jean-Paul has said, we've got an obesity epidemic. In 5 years, we'll have a diabetes epidemic. In 10 years, a heart disease and stroke epidemic. 15 years, a premature death epidemic. That will happen. There are enough obese people in Europe that prevention won't help, that will become a reality.
Prevention of obesity before somebody has already become obese. And that's the mission of our task force, and in fact, it's one of the missions of our organization. And in fact, with primary prevention, that's where you can make the biggest impact, because most of the population is sort of lying in the middle of your body weight distribution, with some out on the extremes. And so by making small shifts in the population's weight distribution, by lifestyle changes, there's good theoretical and some practical evidence to support the idea that you can benefit the largest number of people. So I'm not trying to say in any sense that we shouldn't consider searching for treatment. Of course we should. We need better treatments. Given the topic of today's discussion, yo-yo dieting, simply the fact that it's an issue today proves that we need better treatments. But so I'm also talking with two hats today. On one hand, I'm here to promote the idea of population-based primary prevention, and on the other hand, to talk about yo-yo dieting. So the previous speakers have already described yo-yo dieting, and I see we're running a little bit behind, so I won't tell you that that's a problem, because you all know that. But I was brought into the area of yo-yo dieting many years ago when I was still a researcher in the United States. I was working in an epidemiology group, and many of you have heard the poem by Alfred Lord Tennyson, "Is it better to have loved and lost than never to have loved at all?" And so we sort of adapted that to what we call the weight cycling refrain, asking the questions, is it worse to have lost and regained than never to have lost at all? So that was the question that we were addressing. We were never questioning the fact that the yo-yo dieting phenomenon is a problem. It's a medical problem that you can't get people to, you can't help patients. It's so difficult to maintain one's weight loss. But we were really asking the question whether people are doing themselves harm by yo-yo dieting. Almost every study we looked at showed that people whose weight had this fluctuation pattern had a worse health outcome, independent of whether they had a higher weight or a lower weight all along the way, and independently of whether they were gaining, or losing weight. So what I'm trying to say here is that in spite of all of the, say, early epidemiologic studies, which I have to confess I helped to produce, showing that this pattern was not helpful, there's no evidence that it's harmful to try, and people should keep on attempting to adopt healthier lifestyles and maintain and lose weight and maintain their weight losses.
For those of you who don't know, obesity is one of the biggest risk factors for type 2 diabetes. Diabetes is a metabolic disorder that affects how the body manages insulin. When a person develops type 2 diabetes, the ability to manufacture and control insulin is impaired or no longer works. While there are 3 types of diabetes, it can be developed in different ways. And type 2 diabetes, the one that most of you are familiar with, has been found to correlate with the increase in body weight in both adults and children. The majority of those with type 2 diabetes are considered to be overweight, if not obese. Most people who develop diabetes as an adult do so as a result of excess weight. What response do we have? Well, very much prevention. And although all of us agree prevention is the first step to take in terms of primary prevention, as the predecessor very eloquently put it, it is unfortunately too late for many people who are affected in Europe and across the world. One point I wanted to stress as well is when we talk about prevention, I think it's very important that we talk about the role that all healthcare professionals can have. I've spoken to some of you in the room. We think of doctors, pharmacists, and other types of healthcare professionals, and probably this multidisciplinary approach is what is going to be the most satisfactory, both for the healthcare professionals in the strategies that they develop, but I would argue also for the patients, the people who have diabetes and obesity, so that they understand how complex their particular condition is.
I have learned so much from you in weight management. And please keep going the good work you are doing. GSK Consumer Healthcare is a proud sponsor of EOD since the EOD was launched in 2009, and we very much welcome a multidisciplinary approach. We heard and we know that to combat obesity, the EU has pursued and is pursuing an approach based on voluntary initiatives and a twin pillar strategy of prevention through promotion of healthy diets and physical activity. We agree, we all agree today that this is certainly a sound basis for addressing the issue and reducing the social, economic, and public health impact. However, we heard again today, and EOD clearly shows that complementary measures are required to assist overweight and obese European citizens for whom prevention comes too late.
Since the WHO in the early 90s recognized obesity as a chronic disease, although there have been many initiatives, far too little has happened on the ground that is specific to obesity management in all its aspects. And in addition, the people suffering from obesity still have a too little voice in their local communities, at national level, but also at the European level. And we cannot and we should not afford to consider these 100 million people, obese people in Europe today, as a lost generation, as I've sometimes heard. Behind this figure hides many individual stories, but also, as we heard from previous speakers, as a society faced with shortage in workforce, being required to work till an older age, and being confronted with lack of resources to manage the myriad of comorbidities developing from this disease, we need to engage.
And now, as a symbolic gesture, the organizers proposed to cut this EOD. Stop yo-yo. Yes. Good.